name is Gargiulo. For those of you who don't know me, I'm a medical assistant. I work for a rheumatology practice in Del Mar, California. I work for Dr. Alexander Schickman and Michelle Turk at the Institute for Specialized Medicine. I've been employed here for the past 9 months. The topic on which I'm about to speak on is based on my knowledge, experience, and some research. I hope by the time I am done speaking to you, I shed light on a dark area and provide assistance to anyone who is in need of help or knowledge. Today I'm going to speak about Sjogrens Syndrome. This disorder may sound very foreign to a lot of you, however the symptoms are going to sound extremely common. When many of these symptoms are grouped together, it makes a person's life almost unbearable. Without treatment, it's almost impossible to keep living. Today there is approximately 4 million Americans with this disorder. Sjogren's is an autoimmune disorder which causes a person's white blood cells to attack their moisture glands. About 9 out of 10 Sjogren's patients are women. The typical age of diagnosis is the late 40s. However, it's not uncommon for a patient of any age, gender, or even nationality to inherit or come up with Sjogren's syndrome. Sjogren's can be considered primary or secondary. Primary means the patient has Sjogren's alone. Secondary means the patient has Sjogren's accompanied with connective tissue disorder. It sometimes disguises itself or overlaps other conditions such as lupus, rheumatoid arthritis, fibromyalgia, chronic fatigue syndrome, and multiple sclerosis. A person usually seeks out a rheumatologist for treatment due to their muscle and joint pain. At this time, the doctor may hear that the patient has other symptoms. These symptoms are dryness of the eyes and mouth. That's one symptom, and we all here have had dryness of the mouth and eyes, and that sounds like a very common thing. However, this dryness is so extreme it can cause corneal ulcerations, infection, tooth decay, trouble swallowing, and reflux. The person may experience neurologic problems like brain fog, concentration, and upset stomachs, numbness and tingling of the extremities, reoccurring bronchitis and pneumonia, arthritis pain, and muscle pain. These patients have also been known to have abnormal liver function, and oftentimes issues such as autoimmune hepatitis and primary biliary cirrhosis. After hearing these symptoms, I'm sure we can all agree that living with this disorder can diminish a person's quality of life. It is important for a person to seek out help if they feel that this disease may be something they are suffering from. Rheumatologists are usually the best choice for diagnosis. This field is usually well aware of the tests that will reveal a positive or negative diagnosis. These tests include, but are not limited to, antinuclear antibody rheumatoid factor, SSA and SSB, or immunoglobulins. There are treatments for Sjogren's that can improve a person's quality of life. However, there is no cure at this time. There are over-the-counter medications and prescription medications. One medication that is popular is Nemoicin. This medication comes in liquid or tablet form and helps a person with their dryness throughout the body. The patient can take the drops or tablets to increase moisture. This really helps to relieve dry mouth and other dry symptoms that usually plague a Sjogren's patient. The most important factor is being under the care of a doctor who is experienced in the treatment and care of Sjogren's. There are support groups and websites that can help people with Sjogren's with information and also direction to a better way of life. A great organization is Sjogrens Syndrome Foundation. You can find them online at sjogrens.org. This group was founded by a Sjogren's patient. It has many resources. I hope this has been helpful and informative to all of you. I hope I have given some insight and direction to anyone who feels that they or someone they know may have Sjogren's. If you are interested in being seen at the Institute for Specialized Medicine for possible diagnosis or information, you can visit the website at ifsmed.com. Thank you.